Hi guys, welcome back to Educate channel. So today in this video, we will be dealing about conjunctivitis. So please subscribe this channel and hit the bell button for more updates. So moving to the introductory part, conjunctivitis is a condition where the conjunctiva becomes reddened, congested and painful. It is the inflammation of conjunctival mucosal membrane. So what are the etiology? What all causes conjunctivitis? Some viral disease, that is infectious canine hepatitis, canine distemper, infectious bovine rhinotracheitis. So moving to the bacterial infections, mainly Staphylococcus, Streptococcus, Mycoplasma, Leptospira. Moving to mycotic, it's mainly Aspergillus and Candida. And moving to the parasitic, that is the eye worm, that is Thalassia species, filariid worms, and Setaria species. Next is traumatic or physical injury, that is thorn, grass blades, etc. Next is chemical, that is corrosive agents and tick dips, etc. Allergic, that is mainly pollens and drugs. So moving to the etiological agents. Pink eye or infectious bovine keratoconjunctivitis is the most common ocular disease in case of cattle. It is an inflammatory bacterial infection of the eye that can cause permanent blindness if not treated properly. So it is a highly contagious disease causing the inflammation of cornea and conjunctiva. So IBK is characterized mainly by conjunctivitis, lacrimation and varying degrees of corneal opacity and ulceration. So what are the predisposing factors? Predisposing factors in case of IBK are fan pollens, UV radiations, tall grass, dry and dusty environmental conditions, transportation stress. Sometimes for Mycoplasma bovis, flies act as a mechanical vector. Calves are most likely to develop this disease than adult cattle because the protective antibodies on the surface of eye are very less. So this is conjunctivitis in case of dogs. So moving to the clinical signs, stage 1, in case of cattle, they will be having excessive tearing and increased sensitivity to light. They will blink frequently and there is redness along the eyelids and all. Pain associated with pink eye also decrease their feed intake. So stage 1 will progress to a small ulcer in the center of the cornea, which appears as a small white spot. Cornea develops gradually a cloudy gray appearance due to inflammation. In stage 2, the clinical signs will continue, but the ulcer spreads across the cornea. The ulcer will increase its diameter. As more inflammation occurs, the cornea becomes increasingly cloudy. And at this point, some of the dark color of the iris can also be seen. The blood vessels make the cornea appear as pink, that is pink eye disease. In stage 3, the ulcer almost covers the cornea and the inflammation continues to spread into the inner parts of eye. Sometimes they will be filled with the fibrin-like material, which is a pus-like substance and having a yellow appearance versus the typical brown appearance. Stage 4, the ulcer extends completely through the cornea and the iris may protrude through the ulcer. That is the main problem. This may lead to glaucoma or persistent swelling of the eye. The eye will be completely blind. The eye may go to even completely rupture or will develop a shrunken appearance and enlarge if glaucoma is also there. The eye will be permanently blind. So these are the photophobia, blepharospasm and epiphora, severe corneal edema, corneal neovascularization and epiphora. This is also conjunctivitis in dogs. So diagnosis, presumptive diagnosis is based on the ocular signs and concurrent systemic diseases. Microbial culture can also be done to confirm the diagnosis. So differential diagnosis should be made from traumatic conjunctivitis, that is foreign body material in the eye, Aspergilla multocida, that is sometimes severe keratitis with loss of corneal stroma is present. Mycoplasma bovis and other diseases such as Listeria monocytogenes irritatis, IBK and bovine malignant catarrhal and chlamydial keratoconjunctivitis and thalassiasis. Treatment, ancillary therapy, topical therapy, that is antibiotic solution with corticosteroid or antibiotic solution or ointment will be done. Antiseptic lotion, that is borosing lotion, will be instilled in the eye and systemic NSAIDs will be given to relieve from secondary uveitis or secondary bacterial infection. Also subconjunctival therapy, that is antibiotic and corticosteroid is given through the skin of upper eyelid or lower bulbar conjunctiva. Parenteral therapy, that is mainly through the systemic antibiotics, that is OTC. So prevention and control is through the hygienic management practices, separation of infected animals, protected from ultraviolet radiations, and reduce the incidence of flies and the subsequent spreading of bacteria. Thank you.